The amount of training that doctors receive on nutrition in medical school is surprisingly limited, considering the significant role that diet plays in our health and also disease prevention. On average, U.S. medical students receive about 19 to 24 hours of nutrition throughout their entire medical school, which is crazy. This represents only a small fraction of their total training, which spans thousands of hours across various medical disciplines. The extent of nutritional training in medical school. So limited hours. The average 19 to 24 hours of nutrition education often occurs in the early years of medical school and is typically integrated into other courses rather than being taught as a standalone subject. This can result in a superficial coverage of the topic with little or no emphasis on the practical application in the real world and patient care. The amount and quality of nutrition education can vary significantly between one medical school and another. Some institutions may offer more extensive training, while others can provide even less than the average. In many cases, nutritional education is not a core requirement, but rather an elective or part of an optional coursework. Focus on disease and not prevention. The training that is provided often focuses on the diet and specific diseases like diabetes and heart disease, rather than a comprehensive understanding of nutrition as a foundation for overall health and disease prevention. The impact on patient education and chronic disease prevention. Inadequate counseling. Due to the limited training in nutrition, many doctors, such as myself, feel really unprepared to counsel patients on dietary issues, even though it's very important. A survey of primary care physicians found that less than 14% felt adequately trained to provide nutritional guidance, which is crazy. This can lead to missed opportunities to educate our patients on how to use their diet to manage or prevent chronic diseases. Reliance on medications. With a strong emphasis on nutrition, doctors may be more likely to rely on medications rather than dietary or lifestyle interventions. And while these medications are crucial for many conditions, the lack of nutritional counseling means that patients may not receive the comprehensive care that addresses the root causes of their chronic diseases. The limited focus on nutrition in medical education contributes to a broader gap in preventative care. There are many chronic diseases such as heart disease, kidney disease, diabetes, obesity that are really heavily influenced by diet. But if doctors are not trained to emphasize nutrition, patients may not receive the guidance that they need to make the changes that could prevent these conditions from developing or getting worse. The lack of nutrition education and medical training contributes to a larger public health issue. As the prevalence of diet-related chronic diseases continues to rise, the need for healthcare providers who can effectively counsel patients on nutrition becomes increasingly urgent. So if we improve the nutritional education in medical school, this can have a significant impact on public health by really empowering doctors to take a more proactive role in disease prevention. The limited nutritional training in medical school directly affects the doctor's ability to educate patients on the importance of diet and preventing and managing chronic diseases. Enhancing this aspect of medical education could lead to more informed doctors, better patient outcomes, and a reduction in the prevalence of diet-related chronic diseases. Addressing this gap is crucial for improving both the individual and public health.